Turning to the coronavirus pandemic now, nearly 31 million people have been confirmed infected worldwide and almost 1 million have died. It's led to concerns of a second wave of infections. The United States, India, Brazil have more cases than any other countries. The death toll in the US alone stands at more than 200,000. In Europe, countries from Denmark to Greece have announced new restrictions. France has registered its highest daily number of infections since the start of the pandemic. And Spain's capital, Madrid, is gearing up for a lockdown that will affect 850,000 people. Meanwhile, in the UK, Prime Minister Boris Johnson says people who break self-isolation rules will face a $13,000 fine. Let's talk to Dr. Bharat Pankhania. He's a senior clinical lecturer at the University of Exeter Medical School and joins us live now from Bath in the UK. Dr. Pankhania, we're seeing this massive rise in infections around the world, with many countries now declaring a second wave. Are we any closer to understanding why this is happening?
Oh, it's quite easy to understand, and to be honest, I wouldn't call it a second wave. I would call it a continuation of the first wave. So the first wave, the case numbers went down when we started to go into lockdown and restricted movements and interactions with fellow human beings. And as soon as schools, businesses and lockdown is lifted and we start circulating with fellow human beings, the case numbers go up. And this is what we have seen in Europe, and now we are seeing in the United Kingdom too.
So let's just stay with Europe for a second then. I mean, countries like Spain, the UK, as you say, France, have all seen dramatic rises in cases, particularly in France. Do you think people are just tired of the lockdowns and basically just giving up?
I think so, and unfortunately, we haven't been very good with our messages. And what is needed are continuous, good, understandable messages that the virus has not gone away, don't drop your guard, be careful. Even in the summer months when, of course, the infections go down because we are outdoors, people needed that constant reminding. And I think we've made a little mistake, a big mistake actually, in not continuously reinforcing our public health message, which is the virus is there, be careful.
And there also seems to be a disparity between the infection rates and the death rate. I mean, cases, as you pointed out, are climbing dramatically, but not necessarily the death rate. I mean, how can we account for that?
That's quite easy to also explain, which is that the infections are occurring in the younger age group. And when the infections occur in otherwise fit and healthy young people, they invariably don't get severe illness. But the big concern, very big concern, is these young people, the 20 to 40-year-olds and even younger, who are getting these infections, could then take it to the older people and people with coexisting medical conditions. And then, as we have already now noticed, hospital admissions have gone up and hospital deaths have also gone up.
Just a final thought to you, Dr. Pankhania. I mean, winter is coming in the Northern Hemisphere, with many countries traditionally battling influenza outbreaks. So how is winter then likely to worsen the COVID pandemic, do you think?
Well, what we can do is we protect ourselves with what we can protect against. So my public health advice to everyone listening to me in the Northern Hemisphere would be, please, this year, all of you, everyone, go and get your seasonal influenza vaccine. At least we can protect against what we can protect with.
Dr. Bharat Pankhania, thank you very much indeed for your thoughts. Thank you.
Thank you.